Thank you very much, and good morning, ladies and gentlemen. It falls upon me to follow John Atwell, which is always a difficult issue. I'm Director of Finance and Technology for NHS 24, so part of my role is to make sure that the organisation manages all of its resources in a way that meets our financial targets, but also to spend as much as we can in technology, and that gives me some strange dilemmas to deal with. In terms of what we're planning today, it's very encouraging to see so many consistent themes today. As we've indicated previously, the population growth across the European Union, in the UK and in Ireland, will be extensive over the next 50 years. The number of citizens who are aged over 65 will increase from 80 million to 151 million. And that has very many welcome attributes, but from a health perspective, it does create significant challenges in managing long-term conditions and providing fit and active living. We believe the current health system is unsustainable in the future, and it is a time for change. When faced with these issues, it's maybe it's quite difficult to not feel overwhelmed by the challenge. And within NHS Scotland, we are keen to develop a healthcare strategy, a telehealth and telehealthcare strategy that steers us into calmer waters. And I think this picture is a lot less frightening than the previous one. So what are we doing within NHS 24, within NHS Scotland to move into these calmer waters? First of all, we believe absolutely that the face-to-face contact a patient has with a clinician, with a doctor, etc., is the bedrock of the health service, and that will continue. But by developing all forms of digital technology, multi-channel capabilities, we believe we can help manage that demand forward. So within NHS Scotland, we are taking forward a number of digital technologies. The use of SMS texting. We have schemes whereby we can remind patients of their appointment to try and manage the DNA rates within hospitals. We have video conferencing facilities where we are taking forward a number of clinical aspects around telestroke, around mental health, pediatrics. We are developing social network sites in terms of Twitter, etc., Facebook, where we can provide health information to the population. We are developing mobile applications based on smartphone technology, again, to provide information and advice to citizens. We provide a 24-hour triage service. We provide helplines. We provide areas where we've managed national initiatives in the past around things like the pandemic flu outbreak. We have a number of web pages, some which provide health information, some which provide social care information. We have also developed a digital TV service where people and citizens can access that TV channel via the red button on the TV. And we're also taking forward Telecare based on the Dallas project, which is delivering assisted living lifestyles at scale. And I'll talk more about that later. So we believe we need to secure the fundamental aspects of the health service in terms of face-to-face conditions, but also to use all technologies to try and manage that demand. We will take this forward by taking forward innovative service redesign underpinned by education and training and enabled by technology. And in taking this forward, we don't want to develop one fit for one disease. We want to develop systems that deal with multiple problems, to use technologies to deal with a number of areas, not one solution for one problem. And we need to remember that what can look attractive and impressive in the clinical environment may look slightly different in the home care environment. So we need to reflect on that and take that forward. And importantly, by delivering new technologies and home monitoring systems, etc., we don't want to substitute the institutional care or hospital care for imprisonment in the home. We need to ensure that that technology embraces the wider community aspects involved in promoting active and healthy living. So we want to move from supportive self-management to We want to move from supportive self-management to co-production. And what we mean by co-production is the use of all community assets. Unlock and unpack the wide range of community assets we have within within our country, and we'll come back to that. We will do this within the NHS Scotland by delivering super-fast broadband across the country. That is to all of our remote communities and to our islands. And in developing the technologies to support ActivAge and manage demand, we need to try and keep that technology simple. I mean, a lot of our citizens already are familiar with technology. They do online banking, they can book holidays through the internet. So we want to maximize the use of the technologies that are already there, smartphones, iPads, TVs, and computers. And we need to recognize that a patient's life is a bit of a roller coaster in terms of health. Sometimes they can be better, sometimes they get worse, sometimes they can be better again. And I think in deploying technologies, we need to make sure that they do reflect that individual patient's needs at that time, so that they are flexible solutions. And we need to encourage and take on board our clinicians. And not all of our clinicians in the past have fully embraced new technology. They are very important, very influential, and we do need to take them on board. However, doctors aren't always right. This is an advert, a true advert from America, where more doctors smoke Camels than any other cigarette. But they are an important and influential group of individuals. We need to take them on board when we deploy new technologies. And we believe in developing our healthcare strategy, our telehealthcare strategy, that we needed to take forward active community engagement. We set out upon an engagement model with the community that was led by 3 organisations: the Long-Term Conditions Alliance in Scotland, a group of 220 voluntary organisations, Care Scotland, a group that included all the care organisations within Scotland, and academic input provided by the Glasgow School of Art and Design. And they developed an engagement model called Hidden Talents. And they took this engagement model into the community to discuss with all of our citizens in health centres, in shopping centres, malls, etc. And some of the questions we asked, and some of the questions we asked, what is your talent? How can you share it? What would make your life better in terms of telehealth care? And from that engagement, we had many ideas, many thoughts that we were able to pull together in terms of that engagement model. And the themes from that community engagement are identified on the screen there. There was a recognition that many citizens wish to give something back into the health service. They don't always just want to be receivers of healthcare. Wherever possible, they want to give something back. We also recognized in the communication, the dialogue we had, that for many people, caring for others is not a chore. It's something they're willing to do and willing to share that. Also recognizing the resilience. Citizens want to have resilient solutions to healthcare issues. And they are not afraid to share the skills and experiences they have with others. They want a system that connects people and connects communities. And interestingly, the maximization of technology they're already familiar with. So these were a number of the themes that we had identified. And from that, we realized that there is a lot of goodwill, a lot of expertise out there within the community that we can unpack and unlock in taking forward these solutions. So the service model we have developed within Scotland for telehealthcare, telecare, and the Dallas project is absolutely focused on the individual at the centre. But it recognises that that patient has a wider circle of family and friends, carers who could support that. And that family and friends, that single person, also interacts with the local community. And that local community interacts with the wider world. So how that service model looks with the wider world is based in roots of a number of areas. The community, technology, working with our technology partners and organizations, health and social care organizations, the voluntary sector, and commercial services. So providing technology to take that forward. So our service model is based on a wider world view of that service model, with the patient linking into these areas when required. And part of our engagement model, I also identified a number of invisible resources. We obviously recognized, as we went through the process, that citizens are very comfortable with technology. They do have a lot of technology in their homes, whether it's just a TV or the phone or the computer. And there was a desire that we maximize the use of that in taking forward solutions, keeping it simple. As I mentioned previously, a willingness to give back to the community, whether that was by providing more support to fellow citizens by volunteering, whether it was actually taking care of themselves better, maybe stopping smoking, maybe eating in a different way. John talked about diabetes, etc. So giving back health rather than just being a consumer of health all the time. And we recognized in the discussions we had over those months a huge untapped and probably as yet unutilized or underutilized creativity, skills and experience in the community that we can take forward. So we now embarked upon connecting those communities by superfast broadband, by the model we're taking forward where we can link into voluntary groups, community groups, technology providers, etc. And we have developed these circles of care with the patient at the middle and looking at all of the areas we talked about before: communities, social networks, family and friends, carers, healthcare, telehealth care, social care, voluntary sector, all of the circles of care that can impact upon that patient's life, and with subsets of how that can be taken forward. So our future model, based on the engagement we've taken forward, based on maximizing the use of technology, will look something like that, where the citizen will be able to interact on a one-to-one basis where appropriate, via technology where appropriate, to maximize the active aging and healthy living as we go forward. And this is called our Living It Up Circles of Care. And I wouldn't be an accountant without having some money at the end of the discussion. I do apologize for that, ladies and gentlemen. But the reality is that we are living in difficult economic times. The health model we have at the moment is not sustainable. We need to change. We need to make sure that we safeguard face-to-face care for those who need it. But we need to recognize the implications of an expanding population in terms of age and the need to try and manage that to give them active aging and living. So it is a difficult time to face, and we need to maximize that resource. And we believe the key to success will be collaboration. Collaboration between voluntary organizations, collaboration between care organizations, local authorities, collaboration with academia. Glasgow School of Art have been very helpful in taking some of our thinking forward. And links with our enterprise organizations and our providers, Philips, O2, Vodafone. So we found the key to success will be collaboration. We are embarking upon that model of care, and we hope that in some way we can help the theme of today, active aging and healthy living. Thank you very much.